A former health insurance executive has discussed how he thinks private insurance will attempt to benefit from COVID-19 going forward. Now, as you may have already seen, the private healthcare industry has already benefited from the coronavirus. Let me give you some examples here. So pharmaceuticals like remdesivir, which you see here, Gilead's coronavirus treatment, which is remdesivir, to cost $3,120 per U.S. patient with private insurance. So this is crazy on its own. But if you compare it to other countries, they're able to. Here's an example. Drug maker said it will sell remdesivir for $3.90 per vial to governments of developed countries around the world. Yet, for U.S. private insurance companies, $5.20 per vial. And this is because other countries are able to negotiate down their drug prices. Whereas in the U.S., pharmaceutical companies basically get to price these pills at whatever they want. So you've already seen companies take advantage of the lack of protections, health protections in the U.S. That's one example. Another example, U.S. health insurers doubled profits in second quarter amid pandemic. So this is, it is insane that this is a healthcare system where private healthcare companies benefit when masses of people are dying and sick. If this doesn't tell you that you need to change the system, I don't know what needs to happen. So obviously, as I've discussed a million times, the U.S. has to move to a single-payer medicare-for-all system. It would eliminate this for-profit motive in the healthcare industry. But let me get to Wendell Potter now. So Wendell Potter, as I've discussed before, I've discussed his comments on my show before. He is a former health insurance executive turned Medicare-for-all supporter. So he is now somebody who is essentially a whistleblower on the private insurance industry and discusses openly about the thought process that goes through the minds of these executives at these private insurance companies or these private healthcare companies. And he put out this tweet thread on how these companies will try and benefit from COVID-19 going forward. So he tweets out here, here's an interesting irony. Everyone around Trump who gets COVID-19 may be in big trouble if they get their wish and gut Obamacare. Why? In the future, COVID will likely be classified by private insurers as a pre-existing condition. I know. I used to be an insurance exec. I sincerely hope and pray the president, first lady, and those around them who've contracted COVID will get well. I hope and pray the same for all people here and around the world. Now, here's my concern about what they're doing to Obamacare and how it will affect those with COVID. I know firsthand that before the ACA, insurers kept a list of 400 plus conditions they used to either reject applicants or charge them more than they could afford to pay for coverage. If I were Hope Hicks, I might be concerned that my boss wants to get back to that system. The conditions of my old company would use it to deny care ranged from ones that many babies were born with to the many forms of heart disease and cancer. They also included things like diabetes, high cholesterol, high blood pressure, and even acne. Joe Biden was right when he said that more than 100 million people in the U.S. have a pre-existing condition insurers could use against them. More than 100 million. That's one-third the population. Trump says it wasn't true, but his own CDC said as many as 129 million of us have at least one. And now he and his loved ones do too. If you think the president can use an executive order to force insurers to cover pre-existing conditions, you don't know the industry like I do. They don't want to cover you if they might have to pay big medical bills. They want to make money and reward shareholders and execs. As for COVID, the millions of Americans who've had it could end up with one or many pre-existing conditions. Without the ACA, insurers will shun them. This practice drove the number of uninsured in America to 50 million before ACA was passed, and that was before a pandemic. But this won't just screw over the president and his associates. It will kill and bankrupt many Americans. Please think about that when you vote. So Wendell Potter here going through exactly why it is so important to cover pre-existing conditions. And look, we can have this discussion separate from Medicare for All. Obviously, under Medicare for All, everyone's covered regardless. I live in a single payer system. I've never had any issue going to the doctor. I had surgery once. It was a very simple process, like one sheet of paper. It's planned ahead of time. It was a minor surgery, so I didn't have to get the surgery immediately. A minor surgery, planned ahead of time. On the day it's planned, I go, get it, come home. That's it. No calls with insurance companies, no insuring it, like nothing else. I just go and come home. This is why like, I don't think Americans truly understand, at least those not in the know, truly don't understand how much better life is in a country where you never have to think about healthcare. That's maybe the biggest benefit, is it's never on your mind. I never have to consider it because it's always going to be covered regardless. Whatever I need, it's going to be covered. And even when it comes to pharmaceuticals, I do have to pay out of pocket for that. But most employers have some form of private insurance that covers pharmaceuticals. And even then, though, like because I'm self-employed, I don't have any coverage for private or for pharmaceuticals. And out-of-pocket expenses for that is next to nothing. The most I've paid for a bottle of pills is like $30. That's the most I've paid. And that's for, a month of medication. So the endless benefits to a medicare-for-all system. And look, I know my audience, I discussed this a million times while Bernie was running in the primary. My audience already knows, for the most part, how awesome Medicare for All would be if you had it, and how awesome a single-payer system is. In addition, I mean, there are all these benefits that come up in my brain all the time when I'm discussing this issue. There was so much that I often forget because for me, it's just second nature to have healthcare covered. But, another aspect of this is that because everyone is paying into the same system in a single-payer system, that means that the wealthiest people in the country have the same healthcare coverage as you do. Your Congress people, the same healthcare coverage that you do. So how bad is healthcare really going to get if the wealthiest people in the country and your Congress people have the exact same healthcare plan that you do? You need a comprehensive single-payer Medicare for all system. Now, the fact that you don't have that right now isn't the only reason for the explosion of cases in the U.S. compared to other countries. That I think is part of it, of course, but also, the lack of financial help for people. People feel the need, they have to go back to work. They have to work because they have to provide. And other countries, you see wage subsidies. I think France is covering like 84%, 85% of all wages in the country. Canada has $2,000 a month, what's called the CERB, which is a benefit that you can get if you lost your job or had to stay home to take care of somebody who had COVID, or you had it yourself. So $2,000 a month. Americans have had I think one check and expanded unemployment insurance, but ultimately not a whole lot to take care of yourself. So that's the other aspect of it. People feel the need to go out and make money. They end up getting the virus from someone else at work, come home, give it to their family, and that's how you see the numbers explode the way they do. But that said, just another reminder here of how having a for-profit, the for-profit interest, private companies embedded in healthcare, how it doesn't benefit anyone except for the wealthiest that work in those companies.